Welcome back to Whitecoat Medicine Talks. Today we are going to be talking about a type of medication for high blood pressure or hypertension. Now, we have many different types of medications for high blood pressure. A lot of times we hear patients stating, we're taking too many medications already for blood pressure. Can't we stop one of them? Well, the answer is that you take a lot of different medications because they all work differently to be able to decrease your blood pressure appropriately back to where it should be. So today we're going to talk about calcium channel blockers. These medications are commonly used, and I want to break it down a little bit further for you. So not all the calcium channel blockers are the same. So first of all, we do have two different classes. You have a dihydropyridine and a non-dihydropyridine. So in the dihydropyridine class, we're going to have two medications called Amlodipine, Nifedipine. Amlodipine goes by the name of Norvasc. Nifedipine also goes by the name of Procardia and Adalat. Now, as the name of the class states, these are calcium channel blockers, so they are going to block the calcium channels. But the dihydropyridines block it more on the arteries, smooth muscle. So they're going to reduce your systemic vascular resistance. So basically your arteries are going to open up more, your blood pressure is going to go down better. Now, one of the problems with these medications in particular is that then your body is going to sense that the blood pressure dropped and it's going to want to speed up your heart. So sometimes you can get what's called a reflex tachycardia, or speeding up of your heart. On the other hand, the non-dihydropyridines are going to work a little bit more on your heart. They're going to be more selective towards the heart. Now, this would be the phenylalkylamines, which are the medication you would know as verapamil, which is also known as Kalan or Isopten. Those are going to be the ones that are going to be more selective to your heart and not so much working on your arteries. So these are sometimes used also to treat angina or chest pain as well. So your blood pressure will decrease as your heart relaxes a little bit more as well. Now, there's two classes. There is the phenylalkylamines, and then there's the benzodiazepines. The benzodiazepines is a different medication that's also in the same class as the non-dihydropyridines, and it is called diltiazem or cardiazem. Now, this one is kind of not selective either for heart or for your vascular, but works on both a little bit better. And so many patients will be on diltiazem because we'll get that effect on the heart and your blood vessels as well. There are other calcium channel blockers that fall into these classes of medications. However, these are the most common ones that we prescribe and that most of you will be on. And so your doctor will probably be using one of these calcium channel blockers if they decide to put you on something like this. And what the benefit will be is now you're decreasing your heart rate a little bit, you're decreasing your blood pressure, and hopefully you'll get your blood pressure to where it needs to be. This class of medication, the calcium channel blockers, are used in combination with many of the other classes of blood pressure medications that your doctor will use. You need to talk to your doctor and see what is appropriate for you. As we go through all these videos, we'll be telling you more about all the different classes of medications so that you have less fear about taking these medications in combination, and will understand why they work and how they work and what the goal is that we're trying to achieve with you. I hope that these videos are making it a little bit easier to understand some of these medications, because sometimes it is difficult to grasp what these medicines are doing and why you're feeling the way you're feeling and what it does for your heart and your blood pressure. This is Dr. David Cruz for Whitecoat Medicine Talks, and we'll see you next time, and hope you keep on joining us here. Thanks.